Hello. This lecture will cover the information in the second half of the textbook. So these will be the advanced influencing skills covering chapters 9 through 12, and we'll also throw in 13 and 14 to wrap up the book. So the bottom portion, this is the same as the micro skills pyramid that you've seen in class throughout the semester. We've covered the bottom portion of this, the non-bolded part, throughout class. This is basically what we call active listening. It is also called reflective listening or empathetic listening. It involves following the client as opposed to being directive. This next set of skills are very directive. And so as we talk through these, you'll see how it's different, how the interviewer is directing the work of the interview. The first skill here found in chapter 9 is focusing. And this involves taking the interviewer's perspective and looking at it from a different perspective. I think of it as if you were looking at say, a globe or something, and it's sitting in the middle of a table, and you just move around to a different seat on the table. So it allows the interviewee to see their story from a different vantage point. And the way that you would use this is that you first are using that basic listening sequence to make sure that you understand where the client is focused. So maybe they're focused on themselves in the story. Maybe they're focused on their problem. Maybe they're focused on the other person. That person is such a blah, 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 blah. And then you want to use those paraphrases to say, I hear that other person, blah, 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 blah. You may use a summary to do that. And you decide, well, maybe we could focus on something else. So these influencing skills need to be intentional. So you use an open question to invite an exploration to a different or a switch of focus. And the end of chapter 9 offers 7 focus areas. I guess you would call that foci. I don't know if that's right, but anyways. And so those 7 areas are to focus on the interviewee if they're focusing on something else, to focus on the theme or the problem, to focus on the other's mutual issues, to focus on the counselor's experience or perspective. Now, this is one that also involves kind of self-disclosure in the moment. So it's not like your personal experience with what they're talking about, but it could be self-disclosure, but often it's your perspective on the story. So the person's talking about how that other person is angry, and then you might offer your perspective. Then there's this other big category, which what are the other cultural, environmental, or contextual issues? I feel like that could be more than one big grouping. That may be a different way to look at the story, or a different way that the person could focus on the story. And if they're talking about the past, you can ask them to look at the story from in here and now. What's important to understand is that you're not offering your perspective. You're asking them or inviting them to focus differently on this. So this allows them to address confusion or to broaden if their perspective is very narrow. And it can also give more clarification. So you don't want to use any of these skills if you don't have rapport, because you're obviously taking kind of control of the interview. And if you don't know what direction that the overall conversation is going, you don't want to invite a change in perspective, because where would you go with it, right? So you want to be intentional. And if you are interested in some aspect that's different than their focus area, you wouldn't do it. So it needs to be intentional for the overall goal of what's going on with you in the interviewee. So the second or the next skill here is empathetic confrontation. And the goal of this is to be exactly what it says, to be empathetic in your challenging of what you've observed as discrepancies or internal conflicts. And you're not going against or fighting with a client, but you're just going into an area of confusion or uncertainty. We talked a lot about discrepancies in the observation chapter. And your goal in going into those areas and inviting more conversation in those areas is to help the client come up with growth and change. So, first, you have to observe. Well, first, you have to use the basic listening sequence or that reflective listening and observe the discrepancies or conflicts. When we talked about that in the earlier chapter about observation, when we talked about that, we talked about like often, that's a chapter 4, often you won't actually do anything with that. You'll just note it if you are further along in the relationship. So if you're early, you'll notice the discrepancies, but you're unlikely to do an empathetic confrontation. So you need to decide, is it time? Do we have enough rapport? And is this area of discrepancy related to the interviewee's area where they're stuck, where they want to grow, etc.? So you decide whether you want to use the skill. So you don't confront, you don't elaborate. We need to do this because you don't challenge them. If you decide to confront, you gently paraphrase or reflect feelings concerning the discrepancy. We've been talking for a while, and I hear that you'd really like to do well in school, and at the same time, you're frustrated with yourself because you're not able or you're not allowing enough time in your week to spend studying. So I'd like us to, so did I get that right? They say yes. And then you can use an open question. Could you tell me a little bit more about this kind of conflict that you're feeling? And then there is a client change scale on page 238 that you can use. So if the person is stuck and they haven't been able to resolve this and they keep coming back to these areas of discrepancy, it's a good time to just put it on the table. I'm seeing this and this, and you seem to feel conflicted. I'm hearing you say this, and your behavior is this. It's not quite lining up for me. However, you would say it, you say it in your own way. So we talked about this a lot. Don't confront early in a relationship. That's when you're using the reflective skills for validation. And if the discrepancy is not related to the presenting problem, so let's say they're coming to you for something related to academic progress, and at the same time you hear that they're, getting into arguments with a coworker. Okay, well, maybe that's causing them stress, but it's not directly related to the problem. You just let that go. And if they're not picking up what you're putting down, you're going to probably want to come up with something different. Perpetual confrontation is not going to probably get you where you want. Okay, so those are reflection skills. You're kind of like reflecting and you're inviting, but you are focusing. So you're focusing and you're asking them to elaborate. That's what the first one was. And then the second one that I just covered, you're offering a discrepancy back to them through empathetic confrontation. This also is directive and yet it's reflective. So the reflection of meaning, you are inviting them to tell you what is significant and about what they're talking about. It tells you about their values. It helps them find that deeper meaning or vision, and often will help them get to their goals because it tells them what is important. And often it gets to those underlying or unsaid parts of what's going on so that they can be more intentional or explicit in what they're doing. So here's how you use this reflection of meaning skill. So first, you reflect the meaning or values that you hear in the story, not the ones that you think. So this is not your opinion. You're not offering what you think, but you're hearing the same way when we did with reflection of feeling. So you paraphrase and you put values or purpose or vision, goals, motivation, meaning, that kind of thing into the paraphrase. They may have said it. So as we've talked about your academic history and your academic goals, I hear that doing well in school is a high value for you. So that's not your opinion. That's what you have heard, and you're using the basic listening sequence, those reflective listening skills, to reflect that back to them from what you heard in their story. And then you follow up with a question about that. So it are the is indeed doing well in school one of your high priorities? Okay, and then they can keep going. And you may not even have to then use an empathetic confrontation, but you can go further depending on where they go in the interview. So if there is a lot of confusion about discrepancies, getting to underlying values and priorities can help, and it can move you through the 5-stage interview process when you're really getting to the goal setting and the restory, moving into action. As always with the influencing skills, do not use these early in the relationship when you don't have rapport. And as always, if it's not related to the purpose, and if the interviewee is not abstract, it may not really vibe, or it doesn't work with what they're working on. It may not vibe, but it may. This sometimes this is like a real great key, just like an empathetic confrontation can be a great key. So now we're moving from reflective influencing skills to way more directive. So influencing skills are directive, and these ones are way more directive. So reframing and interpretation and reframing. And interpretation is when the interviewer offers the meaning to the interviewee, as opposed to reflection of meaning. So in all of these things that you're saying in your frustration around school, it sounds to me like school is a high priority to you. That would be you interpreting what they're saying. Reframing, this is offering a different perspective than what they're discussing. Is that you're not arguing, you're offering, right? So in reframing, you might say something like, so as I'm listening to you talk about your struggles with school and managing your time so that you can get your work done, I hear that you're really frustrated. And it sounds like you're really frustrated at your teachers. You're really frustrated at all the workload. I also am wondering if you're frustrated at yourself. So that would be a reframe. So the purpose of this is to get deeper at the story, to go and try to see if you can give a kind of offer these different perspectives. So you're listening when you use interpretation, listen for those deeper themes and do a checkout, just like you would in a paraphrase. I just gave you an example of an interpretation, and the same thing in reframing. Maybe here's another way of looking at it. So be careful with these, because you're now essentially giving your opinion. So make sure that you offer them. You'll notice that I say offer the interpretation and offer a reframe. And don't merely offer these to make you feel better. You want to assess whether or not what you offer is legitimately received. All right, so there's a bunch of different things in chapter 12, and whatever ones of these land for you that you'd like to read more about, you can get into chapter 12. These are more directive interventions that are less about offering and more about, well, I guess self-disclosure and feedback could be offering. but some of the other ones are going to be far more like factually based. And so, what I want to say about these before we get very far is that you want to be careful with some of these, because if you're using the empathetic listening, the active listening, reflective listening, the basic listening sequence, if you're using all of those things on the bottom portion of the pyramid and that person feels really validated, and then all of a sudden you start teaching them something and you've gone real cognitive, but you've really done well using reflection of feeling, reflection of meaning, it might feel a little bit like you've shifted gears and they're like, what is going on here? So you want to be really careful with these. And you can actually, if you're intentional, you can explain to them why you're actually listening to, why you're actually using them. So these are really focused on change. And that's why you would do something so directive, because you feel like that you have, um, you really feel like you have a sense of what the client needs and where the change point is. And so you should be able to be pretty intentional in your use of these. The first one I want to talk about is empathetic self-disclosure. I should probably do a whole slide about self-disclosure. So before I do that, though, let's say that for every one of these, you want to listen, have that basic listening sequence. Like I said, you want to assess, you want to be intentional in your intervention, and you want to check to see if it lands well with the client or the interviewee. So, empathetic self disclosure, this is often used in our interpersonal relationships and in our friendships. And so, let me see, how can I say this? So, this is, to me, this is often the line between helping and not helping. So, professional helping versus like friend advice giving. It is not uncommon for people to use what they've experienced and put it on top of someone else's experience to make them feel better. So someone offers, let's say they've had a really bad health diagnosis and they're telling people, and then other people talk about the time that they received or someone in their life received a really bad health diagnosis. And the person who originally was sharing doesn't get heard, isn't seen anymore. But the person who heard about the health diagnosis, right? Not the one who has it, not the one who's experiencing it, but the person who heard about it, they feel better because they're not actually sitting or bearing witness or holding the space for that other person. This happens a lot in death and dying. Happens a lot in grief work. Generally, it happens often with drug and alcohol counseling. We talk about sharing war stories, right? So sometimes it can happen in trauma sharing, where people just are sharing their stories with each other, and professionals will do this. It shifts the focus. The purpose of self disclosure is not to shift the focus from the interviewee to the interviewer. So, for empathetic self disclosure, it needs to be intentional. There needs to be a reason for it. It should be well thought out. And you don't want the interviewer to feel, or interviewee to feel like they now need to be the helper for the interviewer. So you also don't want to self disclose things that really you are still working through. At the same time, it can be incredibly powerful when when a helper shares insight that they've gotten, personal experiences they've had, etc. So I don't want to say that you should never use this. It just needs to be incredibly intentional. So, empathetic feedback. This is interviewer sharing those non-judgmental assessments or thoughts or feelings or behaviors. Um, it could be as simple as you all have been working together for a while and the person comes in and you're starting to have your conversation like normal, and then all of a sudden, and you notice that person's not really vibing with it, and 10 minutes into it you say, well, it doesn't quite seem like you're feeling today the same way that you've been feeling in our previous interviews. So that's like right there on the spot feedback that you're providing. There's many ways that you can do it. Um, but it's not advice, it's just feedback, but it's your assessment. And it could or could not be right. So when you put it down, if the person doesn't pick it up, that's fine. All right, logical consequences. These are ways of thinking about those. I think you've probably heard of these before. We use this a lot when we talk about behavior with kids and children. Logical consequences. What are those potential outcomes, both positive and negative, for choices? And this is a great way to explore restory, and also then to explore why things happened when people are having existential kind of aspects to their stories when they're exploring them. I also want to add, though, that sometimes the logical consequences fall down because bad stuff happens to good people, right? So logical consequences does not always help, but it can help in pre-planning. It doesn't always help explaining after the fact. So instruction or psychoeducation, this is like direct information. It's not advice giving. It could be advice giving, but being careful about advice, staying in your professional role and giving advice about the reason the person is there, right? So someone might be there and they're in need of housing and of new housing. Let's say they're already in housing, so it's not a crisis, but they're trying to find new housing and they're eligible for 3 different places. And you could say, okay, well, I'll give you some psycho ed on what's available. I'll teach them how they could go through the process. And then I would say, well, I'm not positive, but what I've heard from other people is that this agency is the easiest to work with because X, Y, and Z. I would advise you to, try out the other ones as well, but this is the one that we've heard works best. So that would be educating, providing referral, and giving advice all in one. It doesn't all happen all in one. But there's many ways that instruction and psychoeducation happens. Remember that when you're doing this, you've got to want to think what is good instruction, what is good psychoeducation. How do you know if someone learned? Can you check it back out to see that they've heard you? You may be college educated. The people you're working may or may not be. You may be clear-headed. They might be in crisis, even if, like it may not be like a difference in educational level or of cognitive ability. It might just be crisis that's preventing them from being clear-headed. So these are things to think about. And then directives. So there's a bunch of these around the therapeutic lifestyle changes where we talked about later. And these are like professional recommendations that you might make to someone based on things that they're motivated about, things that are their values that are important to them, that you think might be good for them. Again, this is rooted in what you've already learned about them from the use of empathetic, active listening when you've used the basic listening sequence. So any of these that you use are going to be first used on understanding and knowing the person that you've been working with. Chapter 13 is about theory. And some people would say theory is not important, it's boring. But theory is about worldviews and beliefs. And all helping is based on the helper's underlying beliefs, whether they know it or not. People's behavior is relatively predictable. And not that people can't change, that's not what I'm suggesting. But what I am suggesting is that people act pretty consistent in their helping roles. And if they don't know why they're doing what they're doing, then they're operating from values and theories and beliefs. They just don't know what those are. So this is why theory is important. It helps helpers get to how they understand problems of living, how they can help, how change can happen, what their role is, what the helpee should be able to do, could do, will do, won't do, etc. So each of the theories is going to tell you this. Now, there are a lot of theories out there. I picked a few that often people know about. The reason I picked person-centered is Carl Rogers, because this is the building block of all helping in social work. This is kind of the base. Even if you use other theories, the basic listening sequence is rooted in Carl Rogers' work. There's other ones like cognitive behavioral therapy, dialectical behavioral. Um, there is psychodynamic, psychoanalytic, there's narrative, there's a bunch of different ones that are out there and new ones that are developing all the time. So the key part for you to know is that learning theory is vitally important because it helps us understand ourselves, the problems, our role as a helper. And there's also macro theories about the larger problem systems that'll be at play too. But we're working on interviewing, so we're looking at micro and the micro skills. So there's also tons of different interviewing. So there's brief interviewing, crisis interviewing, diagnostic interviewing for various reasons. There's group interviewing, intake interviewing, which can be informational or social history related interviewing, motivational interviewing, therapeutic interviewing. I should have put et cetera, et cetera. Here's the deal is that in every single one of these theories and in all of these types of interviewing, active, reflective, that empathetic listening of the basic listening sequence, which you know very well now because that's the base of the pyramid, it's vital, it's essential. It is a basic skill. I would go so far as to say, even if you're not interviewing, even if you're not using a theory, just if you're using the ethical code as a supervisor with the people you supervise, you need these same empathetic listening skills. If in everywhere in the field of social work and helping, you're using these. But when you use different types of theories and different types of interviewing, you're going to use the skills differently. You may use more questions, or you may use almost no questions. You may use empathetic confrontation, or you may use almost none. So if you look on page 319, which I encourage you to do, and you look at that chart, it's going to give you an idea of what I mean by how the skills change with the different types of theories and the different types of interviewing. That chart on page 319 is very important for understanding how these things get integrated. Well, speaking of integration, chapter 14 is about integration. And this is dependent on how well you know your skills, how you are able to use your skills, your own personal style, including your cultural communication style, your own what we call personality, your dispositions, and your theoretical approach to helping, which many of you will not know yet, but you will as you continue to grow in the field. So, if you mix your knowledge, ability, personal style, and theoretical approach, then you can begin to integrate. But it doesn't happen immediately. Instead, you're going to apply the micro skills, especially the basic listening sequence, continually in your interpersonal communication. This can occur both at work and in your daily life. People do appreciate being listened to empathetically, so reflective listening is a positive thing to continue to do. You can assess your strengths and areas for growth as it relates to reflection and those macro skills that we talked about. You can learn the various theories and keep going with the types of interviewing, which we'll talk about that for your final exam later on this semester. And then you keep practicing this. You practice each of these individually. You increase your knowledge, increase your ability of the skills, work on your personal style, and learn more about your theoretical approach. And then you use them. And you use them in school, on your internship, and as you work in the field.